use only. It cannot be used as salary. And there's another problem is that everybody knows the hospital and the government cares about the impact factor of the journals. You know, in the radiology field, only a few high impact factor journals. The highest one is, I think, is the radiology. It's about 5.4, which means for the young radiologist, it will be difficult to get the title raise compared to other doctors. The third one is the nervous doctor-patient relationship in China. That's a very big problem in China right now. Because of the low health investment of Chinese government and the large populations and the wrong middle orientation, the doctor-patient relationship in China is very nervous right now. You know, some patients just take their voice recorder to say doctor. In case anything happens, they will make a claim. It's a very big problem, especially for young radiologists, the lack of experience. The fourth is the low pay. The radiologist in China gets the lowest paid among all the doctors. Yeah. And you know, the Chinese doctor gets much lower salary compared with the developed countries, for example, in the United States. The fifth one is the radiology department was separated in 3 departments in China. The ultrasound department, the nuclear medicine department, and the CT or MRI department. In different departments, the radiologists in different departments knows not too much about the other field. For example, as an ultrasound doctor, I know a little about CT or MRI graphs. We learned some, but didn't have no practice. Yesterday night, I just had the chance to talk with a Japanese professor, and his name is Dr. Machu. He told me a story. He just helped teach a Chinese doctor in Beijing to do the interoperative therapy, something like that, image guiding. And he found that the Chinese professor don't know how to use the ultrasound. They have to wait for almost 1 hour until the ultrasound doctor to come to guide the interjection. So it's a problem for Chinese young radiologists to learn. So there are many opportunities and challenges in China. And I have some suggestions for the young radiologists from my experience. And first, I think everybody is busy. But for the young radiologists, we have to spend much more time on this and study and research. That's very important. We cannot change the fact that the clinical demands is very heavy. What we can only do is just spend our free time on this study and research. For example, we have to spend 1 or 2 days of your weekend days, 1 or 2 hours after your work. You know, in the past few years, I almost have no weekends. So a lot of research. And the second challenge is we need to improve the work efficiency. As several professors mentioned at the closing ceremony, we can just carefully design the research before this data was rushing to do it. The second one, I found many young radiologists in China, they don't use the medical software. For some very useful medical software, for example, the envelope for the reference management. They just manage the reference manually. It's very time consuming. The third one is I think we should learn collaboratively with physicians, engineers, chemists, and other scientists to create an interdisciplinary imaging research. I think it's very important. for example, we're doing the ultrasound molecular imaging right now. We need the chemist to modify the chemical materials. We need a pharmacist to prepare the contrast agent. And we need an engineer to analyze the molecular signals. So that's a collaborative work. And also, the young radiologist should keep an eye on the leading research group in the world in order to know what they're doing, and so that you can keep your research on the right way. The fourth, I think, it's important is find a good wife or husband. Without family support, you cannot concentrate your energy on your research or study. I have just the word, I think it's very important. So sure, the Chinese government and the hospital should do something for the young radiologists as well. In China, I think the Chinese government should put more health investment, not only on medical researches. They should also put more on the health investment, so that so it's very important for the improvement of the patient-doctor relationship. Second, the hospital should give the excellent young radiologists some additional time to do their research or studies. In conclusion, the road is tortuous, and as the future is bright, we have to work hard. Thank you for your attention.